Hello and welcome. I am Dr. Lara, a clinical pharmacist specializing in functional medicine, as well as a certified yoga teacher and Reiki master. I run a truly integrative health coaching practice encompassing functional medicine lab testing, yoga and meditation, and a sprinkling of Reiki energy medicine. Join me here on Light Body Radio to break through your health plateau and come into alignment with your natural vitality. Hello and welcome to Light Body Radio. I'm your host, Dr. Lara May, and today we are diving into I think, a super helpful topic, and I think it'll help bring some clarity and some understanding of how functional medicine labs different from conventional allopathic lab testing and why you might choose one or the other. So let's start with the basics. And essentially, we're just going to really quickly run over what are functional medicine labs and how do they compare to the traditional lab tests that you would get from your MD, your PCP, your GP. So conventional medicine relies on standard lab tests to diagnose disease, typically looking for markers that indicate whether you have a condition that meets a certain diagnostic criteria. These labs are designed to detect overt pathology. So think about things like high cholesterol, anemia, diabetes, infections, different types of things like that. So if your numbers fall outside of the quote normal reference range, your doctor may recommend medications, further testing, or different types of things to add to your treatment plan. Functional medicine, on the other hand, takes a much broader perspective and a more proactive approach. So instead of only identifying dis-ease, functional labs assess the body's optimal function. They provide deeper insights into root causes of symptoms. So think about things like chronic fatigue, digestive issues, brain fog, inflammation in general. We're always looking to get to the why, to that root cause. So the idea is that long before an actual disease develops, we're able to prevent it or uncover some sort of imbalances that's already there that we can address to prevent a full-blown disease development. Now, there's still plenty of us out there that already have a diagnosis from allopathic medicine. We're not happy with the way allopathic medicine has treated it or approached it. And so then we seek out functional medicine to also help treat this diagnosis that we've received from some other practitioner. So that's important to know that it can do both. It can be proactive, but it can also be, I guess, what we would call reactive. A lot of allopathic medicine is definitely reactive. But essentially, we're looking at root causes instead of just finding those things that are out of the quote unquote normal reference range and giving you a medication to treat it with. So another key difference is how often this testing is done. In conventional medicine, lab work is typically ordered when symptoms arise or as part of what we call the annual checkup. And in functional medicine, we actually recommend more frequent monitoring, especially if you are managing a chronic disease or you're proactively or actively trying to optimize something in your health. So maybe you're trying to lose weight, or maybe you're wanting to reverse your diabetes or treat your thyroid imbalance, or even hormone imbalance if you're perimenopausal or menopausal, then we would most likely want to check around every 6 months, especially for those hormone things. It depends on the treatment plan, but I would say, a lot of practitioners, including myself, suggest comprehensive lab evals every 6 to 12 months, depending on the individual need. And that's the other fantastic thing about functional medicine, is we really do recognize that bioindividuality, meaning that we know that every single person is completely unique and different. And so there is no one size fits all approach. Everyone gets a personalized approach. And so I think that's also really important to point out. So what would be included in these regular evaluations, or what might be considered like a nice, well-rounded functional medicine panel? Um, and I have actually like a storefront set up on Rupa Health, so that you can go directly there. And if you wanted just to order like the foundational panel that I've put together for my patients, you totally can do that. And I'll put the link to that in the show notes. But that would include things like metabolic markers, so your blood sugar, your fasting insulin, your HbA1c, which is your average glucose over 3 months, lipid panels, thyroid function, adrenal, stress hormones, and sex hormones, especially depending where you are and the different stages of life, nutrient status, so what vitamins and minerals, vitamin D, B12, magnesium, iodine, those types of things. And then, of course, the inflammatory markers, so your CRP, a homocysteine, possibly some food sensitivity markers, especially if we're having gut problems. And then diving deeper into the gut health, we can do comprehensive stool analysis, microbiome testing, full-on GI mapping. So we can really dive deep into the nitty-gritty of the actual cellular level of what's going on with your inflammation. And then, of course, there's also toxic burden. So is it heavy metals? Is it mold? Do we need to put you on a detoxification protocol? What is that toxic burden load in your body right now? So by looking at these markers collectively and sort of like in a big picture way, then we can, and from the functional medicine perspective, offer you a full spectrum approach to long-term wellness rather than just, compartmentalizing everything, much like allopathic medicine does. And so, again, functional medicine is a whole body, whole person perspective, and we're not just going to look at just your thyroid or just your blood sugar if you're worried about prediabetes, or just your cholesterol. For a lot of, obviously, like, we are big organisms, and everything that's happening within us is interconnected. So it really, I think, does us a disservice by hyper focusing on just one thing instead of looking at the big picture. So that's what functional medicine is really going to do with their lab testing, is focus on big picture things, a very comprehensive approach. And so the next aspect I want to talk about is just go a little deeper into what is the difference between a functional medicine lab approach versus the allopathic, meaning, like, what's the difference between a reference range and an optimal range? So within the allopathic world, so that's your typical Western medicine world, these tests use what we call a reference range, and that's based on population averages, meaning that way back in the day when they were trying to establish what is quote unquote normal, they surveyed mostly men, by the way, but they would survey, let's say, like 100 men within like the ages of like 18 and 55, and of all of the different numbers that they got back, they would take an average, and they set the low and the high and the normal, quote normal, based on whatever those averages were. So they didn't take into account any like outstanding or alternative factors that might have affected that either. So if you're barely within the quote unquote normal reference range, you may be told that you're fine, that there's nothing to do, there's nothing to address, even if you don't feel well. And I know a lot of people have encountered this when they go to the doctor. I know I personally have too. I even brought my practitioner a full comprehensive thyroid panel that showed some blatant out of balance numbers, and I was still told, you're fine, there's nothing we need to do here. So it can be really frustrating as the patient to just essentially be gaslit by your Western medicine practitioner. So in functional medicine, we use what's called optimal ranges. So again, we're aiming to identify imbalances before they come full-blown diseases. Or again, if you already know you have a diagnosis, it's all about bringing that your body back into a state of homeostasis, a state of balance. So I just want to give you some examples here, so you have something to sort of reference this with. So the first is a thyroid test, for example. The conventional reference range for a TSH level is 0.5 to 4.5. Now, especially if you're in the realm of healthcare, you understand how the thyroid works probably, and you can also understand like that's a really big range, 0.5 to 4.5. But the optimal range in functional medicine is 1 to 2.5. So it's a much smaller range for that ideal thyroid function to discern and to determine if your thyroid function is within that. So I mean, even if you're going to, just your regular allopathic practitioner, if you can tell, like if you've had your TSH level done, even if it's like annually over the last 5 years, if you're trending up, then that means that there is some sort of inflammation, there's some sort of dysfunction going on in your body that does need to be addressed. So let's say you started out at a 1, but over the last 5 years, you're slowly trending up and now maybe you're at a 3.5. Well, that 3.5 from the conventional allopathic perspective would be totally normal, but from the functional medicine's perspective, for me, that would tell me that there's something that needs to be addressed. We need to look deeper into where in the chemical cascade that your thyroid functions, where is the dysfunction specifically? Because number one, if you're at 3.5, you're above our preferred optimal range, but also too, I would see that you have been trending up for several years. And so this is a problem that needs to be addressed before it develops into full-blown like hypothyroidism or something like that. So the next example I wanted to give you were some diabetes reference ranges. So for the conventional fasting glucose, the range is 70 to 99. But in functional medicine, we consider a 75 to 85 optimally, and that's fasting blood glucose. And for your HbA1c, which again, it's reported as a percentage, but we understand that percentage is an average of your blood glucose over 3 months. And so we can extrapolate based on what that percentage is if you're living at a higher number than is healthy for you, meaning like either you're pre-diabetic or full-blown diabetic, and it just hasn't shown up in your fasting numbers yet. So for the HbA1c, the conventional lab is set to a normal of less than 5.7%, but in functional medicine, we like it to be less than 5.2%. And again, this is a representation of an average over 3 months. And then the last one that I thought that might be helpful for you guys, just to start off with some basics, is cholesterol testing. So conventionally, your LDL should be less than 100 and your total cholesterol should be less than 200. But functional medicine also considers the particle size and inflammation markers like LDLP and the HSCRP, and we can look at oxidized LDL. And so in functional medicine, while your LDL and total cholesterol are actually the same and they are still meaningful, we in the functional medicine world are going to dig deeper because we understand that just the LDL alone and the total cholesterol doesn't give us the full picture. We need to see like how inflamed are you? How big and angry are your cholesterol particles? And because this is really going to give us an idea of what your actual cardiovascular risk is. And so again, it's coming down to a matter of root cause versus symptom management. Allopathic labs focus on diagnosing a condition and managing symptoms. I'm sure you've heard me call it Band-Aid medicine, or you've maybe heard other functional medicine practitioners refer to it as Band-Aid medicine, because essentially we're taking those symptoms and we're slapping a Band-Aid on it. Most of the time that's called a medication. But in functional medicine labs, we are seeking to uncover the underlying imbalances. So nutrient deficiencies, gut microbiome issues, hormonal dysregulation, toxic burden, all of those things that contribute to poor health. And again, we're getting to the root cause of why you're feeling the symptoms, not just the fact that, yes, you're feeling the symptoms, but we want to know why and where it's coming from, and then how we can, again, bring your body back into homeostasis, back into balance. So the other thing that is different between the two is the level of comprehensiveness. Functional medicine labs often measure biomarkers that are not typically tested in conventional medicine. So I've had clients that want to use their insurance, which I totally understand, and they'll say, well, just give me the list of what you'll order and I'll take it to my doctor and have them do it. Okay, great. But I can tell you time and time again, I've heard this in response, like once they do that, their doctor's like, no, I'm not going to order these things. Number one, I don't know half of these things are. Number two, you don't need them. And so it's just a matter of they're educated. These doctors, they're good people. They have the best of intentions, most of them, but they just don't understand the functional medicine approach and how we look and evaluate things. And so, for example, again, coming back to the thyroid, the standard way to evaluate the thyroid is just by checking a TSH. And if your TSH is less than 4.5, then they're going to tell you it's normal and there's nothing to do. However, you can present to them having symptoms, having fatigue, being cold all the time, having dry, brittle skin, nails, and maybe even like you're having some alopecia, your hair is falling out, and they'll still tell you as long as that number is within that normal range, there's nothing for them to do. And so as that symptomatic, frustrated patient, it's really annoying. So in functional medicine, we will evaluate the T4, the T3, the reverse T3, the reverse T4, the thyroid antibodies. We want to know, are you suffering, from a Hashimoto's thyroiditis? Are you suffering from just some vitamin insufficiency? So like if you're low in iodine, then oftentimes just replacing your iodine can help your thyroid function rebalance itself naturally. And you don't need medication and your symptoms will resolve. So, it doesn't take much just to dig a little deeper to find some answers that can bring some relief and again, bring back the homeostasis and bring back the balance. And then just the last thing within this little segment here is that conventional labs tend to take a one-size-fits-all approach. And I think we've covered that extensively in illustrating that through the thyroid. That again, like if that number is less than that, within that range, then you're going to be told you're normal and you're fine, even if you present with symptoms. And again, super frustrating as a patient to go through that. And so in functional medicine, we actually test for the individual. We assess multiple systems in the body. Again, we look at the gut, we look at your adrenals, we look at your food sensitivities, we look at inflammation markers, we look at your toxic burden, so many things based on what you tell us your symptoms are, what your complaints are, or how you're feeling every day. How is your health, presenting or not showing up for you? So the functional medicine practitioner will create a customized plan that will start with labs. Now, I will say too, because, like I said before, there's a lot of us out there that already have a diagnosis. We're unhappy with the allopathic medicine approach. And so we seek out a functional medicine practitioner to help us get to that place of feeling good again. And maybe you've already had a menagerie of labs drawn by your physician. That's totally okay. Any functional medicine practitioner should take those labs if they've been done within the last 6 months. I know I would, especially if it's hormone based. So as long as, let's say, you're a perimenopausal female and you went to your physician, I don't know, 4 to 6 months ago, and they did some thyroid, they did a TSH, maybe they did like a general, like a one-time testosterone spot check, and maybe an estrogen spot check. And then, of course, they did your normal CMP and CBC, and you have all that. That's great. Bring that in. I'll look at it. But then from there, I'm going to not only look to see like what stands out to me as not within our optimal ranges, not just those reference ranges, but the optimal ranges. And then also, I'm going to then order more things to fill in the blanks that we still need to fill in of getting to that root cause and finding those answers for you of where in your body do we need to focus on really bringing back the balance, bringing back the homeostasis. So why would someone choose functional medicine lab testing over conventional lab work? And I think I've touched on some of it, but I'll just go through it very clearly here for you. Number one, you've been told your labs are normal, but you still don't feel well. Many people struggle with chronic symptoms that don't show up on traditional tests, but are definitely revealed through functional assessments. And so that's one way that functional medicine can definitely help. And I'm not saying completely abandon allopathic medicine at all. Absolutely not. Like it still serves a role. There still needs to be what I think is a cooperative relationship between the two, because we can help, even as practitioners, I think we can help each other serve our patients better by, practicing at the top of our games. And so if you're looking for a proactive approach and a root cause approach, then functional medicine is your game. Functional medicine is where you want to go. Functional medicine labs help you optimize your health rather than waiting for disease to develop. If you're dealing with chronic or complex health issues, conditions like autoimmune disorders, digestive dysfunction, chronic fatigue, all of these often require deeper investigation into the root cause. So this is what functional medicine really provides. And there's a menagerie of tests that I haven't even touched on yet that I could do a whole separate episode on how we really get into, again, that cellular function, the cellular level of what's going on with your inflammation to figure out, okay, do we need to remove this toxic burden? Have you been exposed to a mold or maybe even a tick bite or something, and your body is still having this inflammation process? Or is it more of, are you having mental health symptoms that can actually be traced back biologically to some things that are out of balance, that if we just, again, rebalance those things, then your mental health issues will resolve. Sometimes everything is very much connected, not sometimes, all the time. It's very much connected, but sometimes we can address mental health issues by the biological pathways. Of course, the mental health providers out there are amazing, and we definitely still need them for processing and helping healing on different levels. But from the biological perspective, functional medicine can actually be really helpful. And again, so if you want a holistic or whole body perspective, functional medicine testing examines multiple systems at once, and we help to create a truly integrative, personalized approach to your healing path and your healing journey. So again, there are so many different tests out there, but just to give you an idea of where we would start, here's some examples. So for comprehensive gut testing, there's microbiome balance testing. There's evaluating different pathogens within the gut. Of course, there's evaluating the inflammation level and then the digestive function itself. For hormone health, we're going to measure adrenal hormones and sex hormones to assess imbalances that could be contributing to fatigue, mood swings, all the different symptoms of hormone dysfunction. There's micronutrient testing, where we identify vitamin mineral deficiencies that can impact your energy levels, your immune system. So are you getting sick all the time? Maybe you're deficient in zinc or vitamin C, or you have some alternative metabolic pathways that we need to uncover. I'm also a big fan of looking at and having your DNA tested. Do you have some of these SNPs, like the MTHFR SNP, that make you a poor methylator? And that will definitely determine, like, how does your liver function and how does your liver detox and unburden your body from these things. If you have certain MTHFR SNPs, then maybe your detox pathways are compromised and you'll need to focus on different things like sweating, because as we sweat, our body unloads toxins through our skin, which actually gives our liver some relief. So that's really important to look at. Another level or another test that we can look at are food sensitivities and inflammation testing. So we want to uncover food intolerances and food inflammatory triggers that will be contributing to the overall inflammation level in your body. Because if you're adding to your inflammation by what you're putting in your body, you're not helping yourself heal or get better any faster. You're actually doing the opposite. And so then again, there's toxin and heavy metal panels. So we want to assess your exposure to environmental toxins that may be contributing to symptoms. Maybe it's things you've been exposed to through your job. Maybe it's what you're exposing yourself to through cleaning chemicals or cosmetic products, or off-gassing of polyvinyls in your house. Whatever it is, there's a menagerie of things. Again, it could also be based on food. Like if you're ingesting a lot of food that has been treated with glyphosate, then that's definitely going to have an impact. But all of these things we can look at and we can examine and we can determine and we can get down to that root cause, that specific thing, and address it. And to me, that's power. That's knowledge is power. And when we have this information, then we know exactly how to move forward. So a lot of times in functional medicine, you'll hear test, don't guess. So there are, and I will also say too, you can spend thousands of dollars on tests, but in the end, we want to know how are we going to approach it, and will it change how we treat? So this is the same question we ask in allopathic medicine too. When I'm in the emergency room or in the critical care unit, if something is suggested and the answer is, but will it change how we treat? And the answer is no, then a lot of times it's deemed unnecessary to go down that road. And so the same could be said for functional medicine too. Like, in order to get to the root cause, you don't need every single test in the book. You just need a practitioner that will look at your symptoms and know exactly what to order in order to uncover that pathway. And then you can build a treatment plan and a treatment approach based on that. So again, especially if money is an issue, a lot of these tests, they can, especially as they add up, get expensive. But we can also assume certain things within functional medicine. And with that, we can make a treatment plan. Like, obviously, we would want, if you didn't want to do the food sensitivity panel, you could do an elimination diet. It's going to extend the timeline, but you can do that. So, a average elimination diet approach is going to be about 3 months from the elimination, the eating clean, and then the reintroduction phase. So think about that. Like, what is your time frame that you're looking at too? And or maybe you don't want to test for your heavy metals. Maybe you want to save money on the actual testing panel, but you're willing to spend the money on the supplements to go through like a heavy metal detox protocol. So it's just a matter of having that conversation with your practitioners and, having it be open and honest. And, for me, like, I totally get it. And I'm super compassionate to my clients about, where they are financially and what they're able to do or willing to do versus what's absolutely necessary. So I feel like most functional medicine practitioners, I would like to think, would be diligent and conscientious and not over ordering and not, overspending on lab tests. That might, yes, it might give you information, but is it going to change the ultimate treatment plan? If not, then do we really need to know? I've had some clients that want to know every single detail and money isn't an issue and they're willing to spend the money and we order every single test, and that's totally fine. Because the way my practice is set up, I am ordering the tests at cost for my clients. So I am also not making any money personally on these tests. And so I think that's important to ask too, like in terms of the pay structure, where it's totally fine as the client or the patient to ask these questions. And if you're not comfortable with the answer you get, then move on and find another practitioner. You're like, this is your journey. This is your health. You shouldn't feel pressured or guilt tripped into anything. It should be open lines of communication and a compassionate two-way street, I feel like, approach. Because again, it's your body, your health. I'm just your guide along the way, so to speak. So functional medicine lab testing isn't just about diagnosing illnesses. Actually, it's very little about diagnosing illnesses, and it's very much more about optimizing health, understanding your body's unique needs, and taking control of your wellness journey. If you're interested in learning more or working with me to explore functional testing yourself, please visit my website, drlaramay.com, or you can email me from the website, or you can contact me on the socials. I'm at Dr. Lara May on Instagram and Facebook and TikTok. I'm at Dr. Lara May FXN Med, so functional medicine. And I'd be happy to discuss what's going on with you and come up with a plan and hopefully have it be in a way that is totally affordable and approachable, because that's my goal, is to help as many people as possible in the most affordable way possible. So, and I also promised you that I would give you the link to my Rupa Health lab front. And so I will include that in the show notes. And so for the show notes, go to drlaramay.com/podcasts, and all the show notes live there. And just look for the Wellness Illuminated episode that says functional medicine lab testing versus allopathic testing. All right, everyone. I hope you found this episode helpful and enlightening. And I think what I'll do moving forward is I'll take a couple of the most common health questions or like disease states or chronic conditions that I get, and I can do an episode on each one of those to dive deeper into which tests would be appropriate and what those treatment plans might look like from a general perspective. And I think that could be helpful for you too, to shine some light. So maybe know more what to expect if you're seeking out a practitioner. And so you'll know, again, like what to look for and maybe what would be right versus maybe if something seems off to you. So anyway, I hope you all are fabulous, and I will catch you on the next episode.